So welcome everyone, wherever you are in the world, to a very special session tonight with Real Change Live. We have Dr. Bill Pettit with us this evening in London, and it's this evening in London. And Real Change Live is a series which is devoted to really sharing stories of hope, where people have experienced difficult circumstances. And the subject tonight is PTSD and trauma, which is an area that Dr. Bill, as a psychiatrist, has worked extensively in himself and has witnessed firsthand extraordinary stories where people have experienced peace and an end to the suffering of their traumatic memories. So tonight we're going to really be looking at what is trauma, how is it created, how does it work, but also what is it that really can offer people hope for real change when they understand it. And we'll hear some actual stories from Dr. Bill. So really, without further ado, I'd love to hand over to you to hear what you have to tell us about PTSD and trauma.
And the hope for full recovery.
Yes.
That's the important part. Huh?
That is.
Well, thank you. Thank you, folks, and everybody. Thanks, Elizabeth. I thought that what I would do is go back to my college days in speech class, where they told you to tell people what you were going to tell them, and then tell them, and then tell them what you told them. So I'm going to do at least some version of that. But I thought having some idea where we're headed might relieve people's minds a little bit. First of all, this whole area of PTSD and trauma, especially with the whole movement of trauma-informed care and our present ways of dealing with that, is challenging because in no way, it's important that you know that in no way offering hope that everyone can be at peace and fully recover and you're never broken, you're nothing lacking, is not denying the experience that a person's had because of, in response to something that has occurred. So it's important that people know that. But here's the deal. I've never seen anybody who had experienced trauma that doesn't want to be at peace. I'll say it another way. I've never met anybody who's experienced something traumatic that wants to die being righteously miserable. I've seen people that have given up hope that they can be at peace, many of them, because they've been told they're broken. They've been told that what happened to them has broken them, and that they can never fully recover. But I've never met anybody that didn't have in the deepest part of their heart and soul wanting to live life with a light, loving heart, where they were open to receiving love and giving love on a regular basis. And the price of, and what PTSD, those of you that have listened to the very first one on one cause, one cure, what PTSD is a chronic activation via thoughts about something that's happened, we call memories, because the past literally does not exist. 5 minutes ago doesn't exist. 2 minutes ago doesn't exist, except as a memory trace in our head. In a small way, or in a big way, that is the answer that happens for people, is they literally don't see that just intellectually, they see it and they're free. Elizabeth shared just in the last few days the letter from a woman who wrote that she had suffered from terrible depression, anxiety, and it sounds like considerable trauma through the years. And recently watched the first podcast. Am I correct, Elizabeth?
Yeah.
And the light came on. And she's free. And all she's been feeling for the last few weeks is feelings of gratitude and joy the vast majority of the time. And she's free. She's free from the past. And that's what people want. They want to be free from the past, just like worriers want to be free from the future. People want to live in the present with a light heart. I'm going to grab one thing here. It's just right here. My late wife, my wife and I, Linda, have been preparing to do a course that's on Eventbrite, actually, and Elizabeth says she has the information about it. But we're going to be putting it online because we know we have so many international people that would like to participate in a course called "Never Broken, Nothing Lacking: Beyond Trauma and Resilience." It really is about finding freedom from the past. But let me go back to what I said I was going to do. So I'm going to ask you to listen for truth. I'm going to ask you to thank your brain for sharing its comments about all the things you've been told about post-traumatic stress disorder and trauma, and just listen for truth. Trust that divine place of inner wisdom that's present in every single human being. Everyone wants to be at peace. I'm going to share some curious facts. I was preparing we were working on the course, Never Broken, Nothing Lacking: Beyond Trauma and Resilience. And I kept thinking of the cat, the Cheshire cat in Alice in Wonderland. People remember the Cheshire cat? He had that, I guess I can't say poop-eating grin, but he had that silly grin, and he would say I don't know whether he said it or Alice said afterwards, curiouser and curiouser. And that's what came to my mind as I was preparing to do this, because here's the curious facts about and then I'm going to do that. I'm going to go in what is PTSD. I'm going to go through the criteria, and then I'm going to show evidence that the myth is that traumatic events cause trauma. That's the myth. That traumatic events cause trauma. And I'm going to show why that's a myth, but I'm also going to show the grain of truth. You know, my brilliant friend, Dr. George Pransky, in his book, in the Relationship Handbook, and every chapter after the first chapter, he has a myth, a relationship myth, and then he has the grain of truth. It's very, very beautifully done. I'm going to talk about the ACE study, the Adverse Child Events study, and the data from that, and recent studies on older adults with the depression and their history of abuse. And I'm going to show other examples that are exceptions. They're either exceptions to the rule or the rule in action. So let me start with what is PTSD, and I've got the book right in front of me here because we make it up, and with each version of the DSM-5 and the ICD-10, guess what? The criteria change, which is interesting, isn't it? Because we're making it all up. And it's an attempt. PTSD is just like every other psychiatric diagnosis in this 800-page book. It attempt to describe where people are. It has nothing to do with who people are. In my mind, and that's all I'm sharing. I'm not asking anybody to believe what I say. If you're new, I'm not asking anyone to believe what I'm saying today. I'm asking to listen as quietly as you can, to be open to hearing something new. In my mind, every psychiatric diagnosis is caused by chronic mental stress. And it's an attempt, every label is an attempt to describe where a person is, has nothing to do with who they are. Because who we are, the deeper we understand the spiritual nature of these three universal principles, the more we realize that everything and everybody is divine energy. And we're all connected. Einstein knew that. He said everything in the universe is the same energy in a different disguise. He knew that. Sid knew that, and Sid saw that at a very profound level. You know, so here's the criteria for post-traumatic stress disorder. Following criteria apply to adults, adolescents, and children. And I'll read them rather quickly because I won't go through all the details. There's A, B, C, and D. A is exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways. Now, it used to be that you either had to directly experience the traumatic event or witness in person. Now they've said, not only can you witness or experience it, someone can tell you about it. And that's enough to be a traumatic event. Or you can have experienced repeated or extreme exposure to adverse details of traumatic event. First responders, collecting human remains, police officers. My daughter is not a medic, the advanced one I'm blocking right now, that goes to accidents. And she sees people burning out, and she says, you know, I see that doesn't have to be the case at all if you have an understanding of the principles. Presence of one or more of the following intrusive symptoms associated with traumatic events. People have recurrent intrusive memories of it, recurrent distressing dreams, dissociative reactions, flashbacks where they have like movies started in their head as if it's happening real time right now. Intense or prolonged psychological distress at exposure to internal or external cues that symbolize or resemble a traumatic event, and marked physiological reactions to these cues. C, persistent avoidance, trying to avoid having these things triggered, which is understanding. Negative alterations in cognition, mood associated with the traumatic event, and marked alterations in arousal and reactivity. People are hypervigilant. They get into reckless and self-destructive behavior. They have exaggerated startle response, problems with concentration, sleep disturbance, et cetera, et cetera. So you can see what it is. It's a chronic state of high level activation of the hypothalamic pituitary axis, the stress response. It has incredible repercussions in the body, which we'll go into in a little bit. There was a recent study that crossed 20 countries and almost 35,000 participants. I'm not going to bore you with a lot of things, but what it showed was that 71% of the people, or 70% of the people, and that's true in the United States, even in the United States, not just in Somalia or Chad, or in the United States, approximately 70%, I bet it's the same in the UK, approximately 70% of the people have had at least one experience that would rate as justifiable to have post-traumatic stress disorder. If a person has one, the average is 4.5 in this study of 35,000 people. The average is 4.5. The overall incidence of post-traumatic stress disorder of people that had a traumatic event is 4%. That means 96% of the people that experienced a traumatic event did not have PTSD. Now, what that points to is that there is an innate healing ability, that universal mind, I'll call it, divine mind, what we're made of, that if we can have some spiritual and psychological understanding to get out of the way with our analytical, rational mind, that even Einstein said is supposed to be the servant of the intuitive mind. If we can get out of the way, there is a healing, a natural healing that will heal us from any experience we have. As I've said before, doctors do not heal broken bones. They put it in the broken leg in a cast, and they say, don't do any weight bearing. And 6 weeks later, you've got a healed bone. But if you were to take that bone every day or every other day for 6 weeks or 6 years or 16 years and check to see if it was healed yet, it would still be broken 16 years later. Now, there are some traumatic events that people have more difficulty recovering from. And the highest incidence of post-traumatic stress disorder was 17% for rape, vicious sexual attack, and kidnapping, 11%. Those are the two highest. But listen to those statistics, folks. Even at 17%, that means that 83% accessed that mental well-being inside of them, that healing ability enough that at least they did not meet criteria for post-traumatic stress disorder. And even if kidnapped, 89% access that. Now, if you happen to be somebody that has experienced it, please be gentle on yourself. Remember who's talking here. Who's talking is somebody, me, who saw 6 psychiatrists for my clinical depression, not knowing that I was creating it innocently with my own use of these principles on a daily basis, 6 to 9 hours a day, activating the stress response and the resulting depression in my body. So please be gentle, and please, I know what anybody who's experiencing that, what you really want. Huh? So here's what I thought of the cat in Alice in Wonderland. I actually went on today on YouTube, and I got some blips from the old cartoon, both the movie with real people and the old cartoon, and I just loved the Cheshire cat. At the beginning, it's interesting and it's relevant to our talk today. Alice asked the cat. She said, "Which direction should I go?" And the cat said, "It depends on where you want to get to." Well, if you've had trauma and you have to decide where you want to get to. Now, what I know everybody wants to get to is peace. And that's to get an understanding of your mind so that you don't hurt yourself with the use of your mind. That you want to learn to go towards peace, not towards trying to figure it out. Here's what I noticed as I was preparing for this course. Most everyone has experienced one or more traumatic event. Many, not all, but not all people experience an acute stress response to the traumatic event. Most recover considerably, so that after 1 year, only about 8% meet criteria for PTSD. You'll see things everywhere from this study that said 4% to Dr. Friedman's Bible of PTSD. It's called the PTSD Handbook. It's done, edited by Dr. Friedman at the PTSD Center in White River Junction, Vermont. They, in their book, they say 8%. Some people fully recover back to their previous baseline. Of those who do recover fully, their recovery can vary in time from moments to hours, to days, to months, to years, and to many years. This is getting, as the cat said, curiouser and curiouser. Some people actually speak of coming through the experience of trauma to a heightened level of spiritual peace and psychological well-being way beyond what they had prior to the traumatic experience. A woman that my wife treated, and I'll let her tell the story in some time, but a young woman that my wife treated that was raped, after 3 sessions when she came back, said, you know, and as a man, I have trouble even saying this out. It'd be much better if I was a woman and from Linda. But the woman said to her, if this is what had to happen for me to learn what I've learned in the last 3 weeks, it was a small price to pay. I am so grateful for what I have learned. And Linda said that was not the experience she had had prior to utilizing the understanding of the three principles to deal with sexual assault. In fact, sadly, even in our armed forces, when women are assaulted sexually, often by their own colleagues in the service, and they have PTSD, they're sent to a place in St. Petersburg, Florida, which for 6 weeks they have to tell the story. We had a graduate student that told us, I had to tell the story every day of being sexually assaulted by a group, and it was like being raped every day for 6 weeks. And then they wonder why they have a 38 to 40% dropout, even though sometimes my understanding is it's made mandatory if you want to get your disability money. Some people recover partially, but not fully, thus carrying a psychological, physiological, and spiritual burden from past experience that limits their ongoing experience of life, of love, and often increases the chance of chronic pain syndromes, chronic physical illnesses, and an incidence of recurring traumatic experiences. What's the evidence for? The evidence for traumatic events cause trauma and lifelong trauma. The ACE study that some people probably have heard of, it's called the Adverse Child Event Study. You can get it anywhere. There's 10 adverse childhood events. If you have greater than 4, your chances of ischemic heart disease goes up 220%. Your chances of emphysema and bronchitis go up 390%. Your chances of getting diabetes mellitus goes up 160%. You can lose up to 20 years of lifespan with severe PTSD because of the chronic activation of the emergency response. Depression is up 460%. Suicide attempts up 1,220%. Smoking, 220%. Illegal drugs, 470%. Alcoholism, 740%. Injecting drugs, 1,030%. Increased incidence, even if you don't do any of those things, the massive increased incidence in high blood pressure, heart disease, stroke, cancers, and infectious disease. Why? Not from the label of PTSD. That's a label put on the chronic, significant, and severe activation of the stress response via people's lack of understanding, innocently. Other references that that is part of that was from a book by Bruce Perry, whose title is called Born to Love. He's got a lot of good research in there. And there's another book called Problems with Adversity, the Problems with the Adversity Distress Connection by Marilyn Bowman. Anybody that wants to read that. So wow, things don't bode very well. On the other hand, there's tremendous evidence that there's an option. And I put down 2 quick quotes from Sid's Missing Link that I love, where he says, mental health lies within the consciousness of all human beings. I think that includes the 70% that have had some trauma. But it is shrouded and held prisoner by our own erroneous thoughts. He also says on page 107, one of my favorites, he says, if your thoughts wander onto a negative and rocky path, don't take them too seriously. Refrain from analyzing, because I guarantee you will analyze yourself forever, never reaching an end, and fail bitterly to find peace of mind. Now, maybe I've shared too much data with you, so let me go to some stories of hope, and then as we do to out the understanding. You're always reluctant to share stories of hope because people then sometimes use their thinking to get into, well, why can't I get there? Is there something wrong with me? And it's not. It's just a level of understanding. And if you get clear that you want to find peace, believe me, you will be guided by that spiritual force that I'm going to call universal mind or divine mind. You will be guided to see it. You will be guided if you get clear that it's what you want. Obviously, Gandhi, as I said, but Mandela in South Africa, 27 years of hard labor. He should have had post-traumatic stress disorder by the adversity distress theory, but he didn't. In fact, he still had his humanity, and when other people around him wanted to show those whiteys what it was like to be oppressed, he said, no, we're going to show people what it's like to be a real human being. There was an older woman in Great Falls, Montana, that there had been a number of rapes and brutal beatings, and I think some of the women had died. And she opened her door a few years ago. My friend Joe Boyle sent this to me. She realized her door was open as she brought her groceries in, and it was too late, and the man closed the door behind her, a young, muscular man, and she looked at him and she said, "You're the young man who's been raping and sometimes killing older women, aren't you?" And he nodded. And this is not a should, this is where she was. She said, "I hope that when you're through doing whatever you do to me, that you know that God loves you." There's no way that that lady could have been traumatized by anything he was going to do. In fact, it hit his place of mental well-being at such a power and impact that they stood talking for 30 minutes. And somebody had seen something that made them suspicious, and the police came and they broke in and they took him. As they were taking him away, she begged them to be gentle with him. Begged him, the police, saying, "He's lost. He's lost. Be gentle with him, please." I don't know that any of us, and it may be, what do they call it, apocryphal when it's just a story? St. Lawrence in the Christian tradition was being burnt to death on a spit. And at one point he allegedly said to his captors, "I think you can turn me over. I think I'm done on this side." Now, I don't think any of us are going to be asked to have that level of understanding. There was a man whose wife and 4 children, in a book, if you want to read it, is a book by a friend of mine, Dr. George Ritchie, who's now passed. It's called Return from Tomorrow. And when he was a young 21-year-old personnelman in Auschwitz, in freeing the Jewish people from the death camps, they came upon this one group of people who were just as emaciated, but they had life in their spirit. Their eyes sparkled, and they still were alive, and they even would crack jokes. And Eisenhower's people were stunned. They said, why are you so different from the rest of the groups that we freed? And they said they all named this Polish man, whose name is William in English. They called him Wild Bill, and they pulled Wild Bill's record, and I've got to do this short. If you're interested, you can read Dr. Ritchie's account in Return from Tomorrow. They pulled his record up in his village, a little village in Poland, when the Germans came in. They lined up everybody in the village. I think he knew different languages. There was some reason why he would be of use to them. They kept him alive, but they made him watch as they set up the machine gun pods and machine gun down every person in his village, including his wife and 4 little boys. I think he would justify for post-traumatic stress disorder. And Eisenhower's people said, and Dr. Ritchie was a young 21-year-old personnelman, "How can this possibly be? Can you explain this? Why you could be a source of such love and joy and keeping these people even in their emaciated state, their spirit alive?" And he said, "Well, that was a powerful day for me. Obviously, it was a tragic day. I lost all my friends. I lost my beautiful wife. I lost my 4 beautiful little boys. And as I watched that occur, I'd never been really angry very much in my life. And I suddenly was filled with such intense anger and hatred that it consumed my entire body, my entire being. And I suddenly then had the realization that the hatred that I was consumed with was the same hatred that had just killed my family. Only now I had it. I'm not saying I should. I'm just saying what he said and what he saw. And he said, from that moment on, I saw the German soldiers I saw what Sid Banks says, lostness is innocence. I saw him as lostness. And my heart, it allowed my heart to stay where I wanted it to be. And it allowed me to be in service to my fellow prisoners. There's an interview by a man named Dr. Robert Scott that I might have mentioned with a black man in 1988 who had been born in 1868, 3 years after the Civil War. He'd been in the state hospital. He was 120 years old. He'd been in the state hospital for 40 years because his farm burned down, and because he was African American, instead of going to a nursing home, he was put in a state mental hospital. He was, you didn't mishear me, he was 120 years old. He had most of his teeth. He walked a half a mile or a mile every morning. He joked with the nurses. His mind was sharp as a tack at 120 years old. And Dr. Scott was curious about how he could be in this state of mind. And at one point he said, well, it's because I was never angry for more than a few seconds, and I learned not to worry about things I had no control over. And he found out that he was put in prison sentenced to prison for 20 years for walking down the street as a 19-year-old black male in Georgia in 1948 and saying a warm hello and making eye contact with a white woman. He was made a citizen's arrest and placed in jail, with sentenced to 20 years in prison, of which he spent 12 years in prison. And Dr. Scott said, you telling me that you weren't resentful, full of hatred, et cetera, et cetera? And he said, no. He said that for at least two reasons. He said to Dr. Scott, he said, they told me you were an educated man, but you don't sound very educated. He said, no, I didn't do all of that to myself because, number one, it wouldn't be gotten me out of jail. And number two, it would have ruined my day. It would have ruined my day. Viktor Frankl, who was in a death camp for 3.5 years, where 1 out of 28 survived. One of my favorite quotes of his is, between the stimulus and our response, there is a space. It is in that space that our freedom lies. And to me, understanding the spiritual nature of these three universal principles of mind, thought, and consciousness, that's where the freedom lies. That's where we have more ability to access the freedom we have between the, quote, trauma and our response, and how long we stay in that response. Some of you have heard the story of Nicole Citrangelo. I'm going to do it briefly here. I can make it available by email. Nicole said I could only share it if I shared her name. I'd be having her share it on a video, except she was killed by a drunk driver about 5 years after she got her well-being back. My name is Nicole Citrangelo. I graduated from college December 94 with 2 degrees. 3 months later, I was brutally assaulted and nearly murdered by somebody new in college who had become a Massachusetts state trooper. The assault lasted over 8 hours, in which I was beaten unconscious nearly to death, kicked, punched, tortured, and raped, all while locked, loaded semi-automatic 9mm was held to my head, et cetera, et cetera. Over the next 9 years, I was hospitalized 23 times. She had 40 different psychiatric medications given to her, 40. Her mother told me she once walked out of the hospital with 19 prescriptions for psychiatric medicines. She was extremely suicidal, made numerous attacks on my life. One of those, I was in coma for a week, saying there was no medical explanation why I lived, the doctor said. I thought that night had changed, that horrible night had changed my life forever. And guess what? The traumatologist people told her that too. They said that she was now broken and the best she could do was cope. A doctor, after one of these intensive places, she went from one traumatologist to the other in Boston, where the top people were, and even in Morgantown, where there was a nationally known center. You are permanently damaged, and you would most likely never able to return on your own again. Hearing this prognosis, I felt doomed and began drowning my feelings of hopelessness in alcohol and drugs. Some of you have heard me tell the story that I came on the unit one day and she was there saying, why won't they let me just die? I just want to die. And I spoke without even permission and said to her, whatever you want to die over is over. It's over. It exists only as a thought in your head now. And she yelled and screamed at me for nearly 3 minutes, and I understood that I didn't know who she was, I didn't know that, and I said, it's all true after I waited and made sure she was through. But I said, what I said was true too. It's over, and it only exists as a thought in your head. And because of what you've done, what you've experienced, and what you've done in response to what you've experienced, you've given up hope that you can be at peace. But I know, absolutely know that you can be. To make a long story short, within 18 months, she was off all medications. She lived 5 years in an incredible state of mind, was ready to go back to law school at a time when she was killed by a drunk driver. Her mother called me that morning after she was killed and said, as much grief as I have, I want you to know how grateful I am that after 9 years of hell, wondering when she was going to die, I had 5 beautiful years with 5 years of beautiful memories that I will have forever. This is a testimony from a Paul, who was in the United Kingdom Army, and he talked about how he had suffered with PTSD for 5 years and 12 years of torture. And he talks about his recovery, how he was taking 32 tablets a day, using alcohol on a daily basis. And again, he said, principles in 2011, I came upon the principles. They've taken me to a whole new level of human experience. Without question, the 3 principles, understanding the 3 principles, have proved not only the quality of my life and that of my wife and friends around me, but also has given me a wealth of happiness that I hadn't up till this point experienced. And most importantly for me, a quiet mind. Wow. Now I know that I only ever need to look inside for my happiness, that bad things happen to all people, and that is the way that I think about the situation that determines the outcome. I would like to point out at this stage that everyone has their own inner wisdom. And when I was about to commit suicide, my inner wisdom, that little voice in my head, said, don't do it. You'll regret it. It will be okay. I am so glad that I listened to that inner voice of wisdom now. I could go on and on. Ofer was a soldier that I met in Israel when I was with Rabbi Chaim Levine. We worked with 27 soldiers from the 2 Lebanon wars who had both physical injuries and PTSD. He said, I was a sergeant in a combat unit, in the special paratrooper unit. There was 10 in his unit. During combat, I lost my eye and all 9 of my comrades, all 9 of his fellow people in the unit, most of them dying in my arms. I was 26 at the time. My life became a living hell for the next 5 years. For my actions, I was awarded the Medal of Honor from the Israel Chief of Staff. He now has a degree in psychology, and he utilizes the 3 principles to help soldiers and veterans who have PTSD. I had a unit I was a psychiatrist on a psychiatric unit, and I'm just tell a couple of stories from there. One was a beautiful 20-year-old Irish girl who had been sexually abused from age 7 to 12 and had gone to traditional therapy for years at different times, but every time she did, all they wanted to do was take her back into the pain. And she would start using drugs and alcohol and have suicidal thoughts, and she knew that that wasn't where it was, but she didn't know how to get the answer. She finally made a very serious suicide attempt. She was admitted to our psychiatric unit, and on a Monday morning, I sat with her for nearly 2.5 hours because I saw she had absolutely no hope. She watched Sid's 4 videotapes twice over the next 48 hours, and by Wednesday morning when I came in, she looked radiant. This is in 48 hours, folks. She looked radiant. I said, "You look wonderful." She said, "Dr. Pettit, I feel wonderful. And I haven't felt wonderful since I was 6 years old." People ask why we're passionate about this, teaching people or pointing people towards these universal principles. There's a reason why we're passionate about it, because it brings hope to every human being in the world to have peace of mind. The other one, sometimes I've told, there was a lady that had terrible history of abuse, physical, sexual abuse from a very young age. She made a very serious suicide attempt. She was in coma for 2 or 3 days. When she finally got medically cleared and we came down to the psychiatric unit, she was yelling, screaming, calling me names, every name that she could think of. And I listened and listened, and finally I said, "Listen, if you watch these 4 videos twice through, and you promise to come back for your follow-up visit, or if you become suicidal, I will discharge you tomorrow morning." And she said, "Fine, I'll watch your," begins with F and ends with G, videos. I said, "Great, that's all I'm asking you to do." And I said, "You see, I know what you want." She said, "You don't know what I want." I said, "Yeah, I do. Like me and every other human being, you want to be at peace." The next morning, she came in and she sat down with tears streaming down her face. And I sat quietly with her for a couple of minutes. Finally, she spoke. And she said, "Dr. Pettit, I apologize for the way I spoke to you yesterday. You didn't deserve that." I said, "It's okay. It's okay. I understood." She said, "But I want you to know that these tears that are streaming down my cheeks right now, they're not tears of sadness. They're tears of gratitude. Because for the first time in my life, I feel hope that I can be at peace." Now, she and the person before her both came. They came into group therapy for probably 8 times and maybe 6 to 8 individual sessions. And then they went their way to live their happy life. They learned that flashbacks were just videos, little podcasts that got triggered. They weren't real. They weren't happening now. Yes, they'd happened, but they weren't happening now. And they let them be as quietly as they could. They didn't fight them. They didn't try to get rid of them. They knew like it was a bad commercial that you'd seen 48 times that you hated. And every time they let it pass, the Star Trek view of the force field weakened to where the day came that the memory had absolutely no power. Its force field had been cleared. And at that moment, the avoidance symptoms left because there was nothing to avoid anymore. Because they were no longer afraid of their computer brain and what memory it might draw out from reading or TV or a movie. The memories had no power anymore. They were seen for what they were. So it's important that I'll say again, this understanding of the principles is not telling anybody how to be or how to act. It's letting you know how the system works and that we are all spiritual beings. We're all divine energy. We have divine spiritual energy that's there to help us every moment, that will heal anything. And if some people get stuck, they say, I can never forgive that SOB for what he did to me, or I can never forgive myself for what happened to me. If you become clear that you'd like to live your life fully and not die righteously miserable, if you become clear that what you really want is peace of mind, I guarantee you, you will wake up one morning with a grin on your face, and you'll be there. I had an experience and I have to be careful because I see different clinics, and I know most of you are in a different country, but I certainly would never want to do injustice to somebody that I'd seen. But in the last few weeks, I saw a person on telepsychiatry, 1,600 miles away. And he had been a psychiatric patient in and out of hospitals, suicide attempts. He's on a number of medicines, but I just listened, and I think he must have felt something, because he then told me something that he had never told a psychiatrist in the last 25 years of his psychiatric care. Something that happened when he was in his 30s, when he was very stressed out, that because he didn't react as he sees now, he wished he would have immediately, instead of he was so caught up in his painful thinking at the time and his stress, that a child 4 years old died. And he, every night, has been blaming himself for 25 years, and actually believes that this idea, and this is for another thing on religion that would be very, I suppose, loaded, but the idea that there is a being, that divine mind, I can see why these principles get confused with religions, because if you truly see what the divine mind, the universal mind is, you see that it's pure love and understanding. And it's not some energy that's going to punish people forever, any more than any parent would ever do that to any one of their children. But he had the belief, and is living with the belief, that he's going to be punished and tortured forever because of not responding in the way he wished he would have 26 years ago. And I spent an extra half hour, I was fortunate enough to have it, to try to awaken some hope in him, that whatever he thinks is beyond there is forgiven him, and he's forgiven, and it's time he forgave himself. That 35-year sentence is far, far beyond what a moment of making a bad decision in a moment of stress, because we've all done it. We've all had things that we say, God, what was I thinking? With that, I'm going to stop, and I apologize for going late. I do apologize. My goal is to awaken hope.
And you have touched, the stories you've been telling are deeply, deeply touching. And I know that for sure. But everyone's very quiet this evening. They haven't actually asked any questions, but I have a question. So guys, if you've got any questions, please, there's some thank yous and some kind of tuning in with the messages. But the question I have is it feels almost small compared to the big hugeness of what you've been sharing. But could you talk a little bit about trauma in the body, the physical aspect of it?
Mm-hmm.
Because what you said earlier, so I'm guessing people have a physical reaction when they are traumatized as well, because the experience of their thinking and feeling also manifests in the body. And when they hear a sound or something, that then their body does the same reaction. Could you talk a little bit about that physical nature of it?
Sure. When we think of behavior, there are three aspects to behavior. You can even write these down if you want to. One is cognition, what you do with your thinking and what you pay attention to, right? That's the big one. What you pay attention to, which thoughts you pay attention to, and whether you have become aware that as soon as you lose a positive feeling, it doesn't make sense to pay attention to your thinking anymore. As soon as you lose a positive feeling state. Remember what Beverly said. Keep your mouth shut. Don't tweet. Don't email. Keep your hands to yourself and leave your thinking alone until you feel better. So cognition, what you're doing, what your thoughts you're giving attention to, that's one point of action. Your behavior, what do you do? If you create a tremendous amount of stress inside, you're going to look for ways to relieve it, whether that's hoarding or eating and puking or using IV drugs. Some of the ways that we've said people with PTSD try to get relief from drugs and alcohol or behavior. They're just trying to get some relief. What happens is the body, we talked about, when you activate the stress response, if you're chronically activating the stress response, it's almost, some of you can't see, but I've taken my mouse, my computer mouse, and I've put it right on the edge so that 1/3 of it is leaning over the edge. It doesn't take much of a push behind it for it to fall off the edge and to have a tremendous panic attack or startle response or whatever. If a person is living in a state of constant high tension, the very slightest thing is going to throw them over the edge. But if a person like that, like Paul shared with PTSD, that he learned to, because of what he learned, the principles, he started living in a quieter and quieter mind. What Sid Banks talked about is a meditative state, that it's possible for every human being. As people start going in that direction, then those memories have no power anymore. That's what people said to me. They said, Elizabeth, that those memories that I used to get that would startle me, now they literally had lost the power. They had, because I was such a quiet state now, their physiology was not in a constant activation, high level of activation of norepinephrine, noradrenaline, pouring hundreds of millions of molecules of glucose. You know, I heard something last week, 1980 in the United States, it was unheard of that we had teenagers with type 2 diabetes. If it happened, it was incredibly, it was a major thing to write up. We now have over 60,000 teenagers with type 2 diabetes. Because why? In a constant state of stress and anxiety, they're pouring hundreds of millions of molecules of glucose into their bloodstream. And it's putting such a load on the pancreas that the pancreas finally says, I can't do this anymore. I'm giving out. As far as the body goes, constant activation of the stress response, as we said on the body thing, knocks out your immune system 40 to 70%. That's why these people die of infections. They die of cancers. They die of heart disease, norepinephrine and epinephrine. You become hyperclotable. If you had nothing but a club to give you a chance against a saber-toothed tiger, you wanted to be hyperclotable. So that if he clawed you in your shoulder and you stunned him and got away, you would be able to put pressure on that shoulder and it would clot. But if you're hyperclotable now, worrying about your grandson's drug disease, your mom's breast cancer, or your father's alcoholism, or your brother's drug problem, or your or your layoff at the office, or whatever you think you're justified in giving your peace of mind away to, and limiting your access to wisdom, your body will scream out. It's screaming out. To me, most of the things that we call diseases are the body screaming out and saying, please listen to me. I'm trying to give you information. That, as the Cheshire cat would say, you're going the wrong way. If you want to find the white rabbit, he went that way. If you want to find peace of mind, go that way.
Is there an insight that you would say people see that gives them that peace after they've suffered an extraordinary trauma? Would you say there's a key?
You know, Sid said there's an infinite number of insights into the spiritual nature of these three principles. So I've said anytime I feel emotional pain, I get excited because I know that the only person that can cause me emotional pain is in the same underwear I'm in. There is nothing external to me or nobody that has the power to cause me emotional pain. And the moment, no thought, no behavior on somebody else, nothing. They can cause me physical pain, but they cannot cause me emotional pain. I am the only person that has the power. That man that spent 12 years in prison, he said, why didn't you do that? You know, why? He said, because God has given me a joy, a place of joy and peace in my soul that nobody can take it away. They can hurt me physically, but nobody can take. This is a little old black man and 120 years old with 3 grades of education, that nobody has the ability to take away my joy and my love and my peace of mind. I am the only person that can give that away. Now, what is it about the 3 principles, the insights? I'll just take a shot at what you said, Elizabeth, see what comes to mind. One is, if I truly believe that we're all, or see, we can't believe it, but if you start to see that we're all connected and we're all the same energy, and if you start to see that you are guided every moment, and that if you get out of the way of it, that the answer to healing is not in your analytical thinking. It's in allowing your mind to quiet enough so that the healing can occur, number 1. So you know that healing occurs. Number 2, if you know there's psychological innocence, if you truly know, as Sid says, that people that do bad behaviors are lost, and there is innocence in lostness. If you see that, you will forgive yourself and you will forgive others. It'll just be natural. It won't be an effort. You won't have to try to do it. You'll just see it. If you see that the past truly does not exist, it doesn't exist except as a thought. And once you see what a thought is, and that the past does not exist, it doesn't exist in the present moment. 30 minutes ago doesn't exist. Once that is truly seen, not up here, but it's truly seen here, there is nothing from the past that has the power to hurt you. I love, I've told this story before, but I love Dennis the Menace. How many people remember my Dennis the Menace story? 2, okay, 3, that's going to justify me to do it again. Dennis the Menace had this little lady friend, Margaret, right? Little girlfriend. It wasn't a girlfriend, but a friend who was a girl. And Dennis, in the first one, Margaret comes up and says, Dennis, I'm having these horrible nightmares. They're horrible. They're horrible. And Dennis, very quietly in the next one, says, Margaret, nightmares and really bad dreams are really good dreams. And really, really good dreams are bad dreams. And Margaret looks like a number of you look right now. Like, what in the hell he's talking about? And in the third one, Dennis has to explain. He says, well, think about it. He says, when you wake up from a horrible, horrible nightmare, it's not happening right now. It's not true. That's really good. However, if you have a really, really wonderful, wonderful, great, great dream, you won the lottery, you won the whatever, you won the state champion, you wake up, it's not true. And then they show Mr. Wilson scratching his head saying, I hate it when that kid makes sense. I just hate it. Now, am I lessening traumatic memories? No, or traumatic memories, because it takes a level of understanding. I'm listening to a 30-hour course on World War II and just finished one on World War I. And some of the horrific experiences of the people that survived, believe me, I've got two, my mother-in-law's got two brothers, 93 and 96. And both of them were in the Pacific in the Philippines, in Guadalcanal and Saipan and Iwo Jima. And they had incredible memories. And one of them talked to my mother-in-law and said, I have to tell somebody some of these stories, but please don't promise me you won't tell anybody. And she won't. And I didn't ask her to. But both of them must have seen something that allowed them to live to one's 94 and the other's 96. So they didn't die 20 years early because of their physical stress on their body. They found some way to be at peace, some level of understanding that's allowed them to not be jerked around by their memories. I don't know if that helps, Elizabeth. It's the best I can do.
Fantastic. And I think everything tonight has been so rich. I want to give Leela's on the call. I want to give her a chance to say anything that she's heard or sum up, really, because I think this subject is so close to so many hearts. And I have to just give a shout out to David Hill, because when we first did this series, I realized that we both realized that we needed to not just do 3. We needed to do 13. And what I knew for sure was that after chatting with David Hill, that we needed to do one on PTSD. And I'm really so grateful that you've done this tonight, because I think what you've really said tonight has really reminded me how powerful that everyone wants peace.
Everyone wants peace.
And that you started there and you finished there. And I thought that was beautiful.
No.
So Leela, is there anything for you you'd like to chip in with and say?
Well, it's really interesting. I just, my whole experience, and I'm putting this down to my own level of listening, is just really feeling like everything, I just want to digest everything Bill said. I have no connections of dots, or isn't that really fascinating? Because sometimes I get quite excited by what Bill's talking about, but actually I feel really different today. I really just feel like digesting what he said. Does that make sense? So I don't have anything particularly valuable to add other than that. I just I could really feel your stories, and I really feel like I could feel it affect me, but I don't have anything clever to say. I really appreciate today.
That's nice, Leila. You've heard me use the metaphor before. If you walked into your old family doctor 30 years ago with walking pneumonia, he would give you an injection of 80,000 units of penicillin G, and you would walk out of his office and you still have walking pneumonia. But 48 to 72 hours later, you wouldn't. So I think your metaphor is kind of a good one. What's happened is this has just been an injection. And the best thing to do is not to think a lot about it. But if people can, thank their brain for sharing its comments and just allow the injection to percolate in that wisdom, because some of it's gotten through. There's a quiet, I can feel it even as I look around, that some of it has gotten through and it's bouncing off that place of wisdom. The wisdom I have within me is the same wisdom every human being has within them, including all of you. There's not one of us has better wisdom inside of us. It's just about accessing it. So to the degree that we just let this settle in, then that will happen. And I'll say again, to me, it's clear that maybe the first book of 50 to 70 pages will be Beyond Trauma and Resilience, Never Broken, Nothing Laughing. That will be the first book to be written by Linda and I. And that course that'll go from like Wednesday afternoon to Saturday noon in cities here in the United States, and then online we're going to set up either 8 to 10 weeks course online. I think will be helpful to people too. It'll give us a chance to answer questions more in depth and have a discussion and awaken each other's wisdom.
Wonderful. I think that's a good point to close. And I just cannot thank you enough. I think it's exactly right. It's been very nurturing and nourishing, this conversation. And it's gone deep. and I could really feel the quiet that you were talking about in the group. And just to let everyone know, this Real Change Live is about habits and other addictive disorders. So anybody that you know who's struggling in that area, we'll be talking about that one next, and how habits are created and addiction. So we'll let everybody say good night.